In the first seconds after a successful resuscitation, even before the patient regains the strength in their voice, something usually happens, something that Elisabeth Kübler-Ross heard so many times over decades that it ceased to be an exception and became a recurring clinical sign. As soon as they returned to consciousness, many patients would say with surprising clarity, "I was not here." This phrase, repeated by unrelated people in different hospitals across different decades, became the starting point for one of the most robust and least publicized investigations into near-death experiences. Kübler-Ross was not looking for extraordinary stories. She was interested in patterns, and the patterns appeared quickly, almost always in the first minutes following the return of circulation. Patients reported having witnessed their own resuscitation from outside, describing details that, from a medical standpoint, would be inaccessible to someone who was clinically unresponsive. One patient, treated in a European coronary unit, stated that he was observing the team as if half a meter above the scene. Another described the exact face of the doctor who arrived last, something he could not have seen from his position lying down, in cardiac arrest. These testimonies did not emerge in prolonged therapeutic sessions. They arose right there, on the gurney, in the emergency room, when the patient could barely open their eyes but was already articulating clearly what they had perceived. Kübler-Ross wrote everything down with the precision of someone who knew that, at that moment, there was no time for narrative construction, fantasy, or emotional elaboration. What was said was described as a pure record, direct, immediate, unembellished. As the years passed, she realized that these accounts did not depend on personal beliefs. They came from religious and non-religious people, from young accident victims and elderly heart patients, from health professionals and ordinary citizens. The diversity reinforced the phenomenon. The more the patients' profiles varied, the more surprising was the repetition of the same elements. A sudden sense of peace, a total absence of pain, a heightened perception of the environment, and the constant impression of a displacement of consciousness. The aspect that is most intriguing to this day is the accuracy. Kübler-Ross documented cases where patients described technical team conversations, equipment changes, and even minor errors during the procedure. A German nurse, upon regaining consciousness, described the moment a defibrillator had to be quickly swapped for a spare. "I saw you asking for the backup equipment," he told the cardiologist, who confirmed the incident, which occurred while the patient was clinically pulseless. These accounts formed a body of qualitative evidence that rarely appears in public debates. They were not philosophical interpretations, but data collected in a medical environment, on the border between life and death. And for Kübler-Ross, the repetition of these patterns over decades revealed a blind spot in modern medicine: the patient's subjective experience at the exact moment when consciousness should, theoretically, be absent. As the years went by, Elisabeth Kübler-Ross realized that near-death experiences did not only happen in dramatic or exceptional moments. They arose within the most common hospital routines, during prolonged hospital stays, cardiac surgeries, household accidents, or sudden crises of respiratory failure. And it is precisely this clinical banality, this occurrence within the hospital every day, that made her record so compelling. The researcher observed that when the patient returned, often still disoriented, a specific lucidity emerged, an unexpected precision in the descriptions. German professionals who worked in intensive care units in the 1980s and 1990s reported a repeated situation to the researcher. Even before asking how the patient felt, they would hear spontaneous accounts of seeing the scene from above, feeling light, hearing everything but without a body. Kübler-Ross treated these statements as objective data, not as metaphors. For her, the methodological leap lay precisely in listening without interrupting, collecting before interpreting. Gradually, the psychiatrist began to recognize nuances. Patients described not only the displacement from the body, but also specific changes in sensory perception. One cardiac arrest survivor told her, I saw everything clearer than with my own eyes." Another reported that sounds seemed organized, as if they were coming from a single point, even though the room was full of people. These details, repeated over thousands of interviews, formed what Kübler-Ross considered one of the least discussed parts of NDEs, the clarity of the state of consciousness during those moments. And there was something even more subtle, the emotional change. While the team was fighting for the patient's life, it was common for the patient to later report feeling absolute calm. A European cardiologist confided to Kübler-Ross that he would never forget when an elderly, newly recovered patient told him, "I heard all the confusion, but for me it was like stepping into a peaceful lake." He, accustomed to dealing with daily emergencies, admitted that he never understood how someone could associate a resuscitation, frenzied pace, imminent risk, with a feeling of peace. These emotional perceptions were repeated in accounts from different cultures and countries, something the researcher considered too relevant to be ignored. The absence of pain, another constant characteristic, appeared even in cases of severe trauma. Polytrauma patients, who should have been in extreme suffering, described the critical moment as light, peaceful, as if the body wasn't mine. Kübler-Ross carefully recorded these statements, knowing they could help explain why so many survivors of severe events had sensory memories so distinct from what would be physiologically expected. Another point the psychiatrist highlighted was the absence of cultural variations in the initial stages of the NDE. Although later interpretations varied according to individual beliefs, the clinical phase, the moment of loss and return of consciousness, remained almost identical in reports from Japan to Germany, the United States to Switzerland. For her, this suggested that there was something profoundly human in how consciousness behaved when vital functions were suddenly interrupted. This universality bothered the more conservative sectors of medicine, accustomed to treating any subjective phenomenon as a physiological epiphenomenon. But Kübler-Ross argued that even if the cause were purely biological, the patterns were too consistent to be treated as mere coincidences. She maintained that the investigation should not seek to prove beliefs, but to understand what these accounts indicated about the human experience at the threshold of death, an area little explored, precisely because medicine rarely listens to those who return from it. As Kübler-Ross advanced her observations, something increasingly caught her attention: the precision with which many patients reported events that occurred while they were, according to clinical parameters, unconscious or pulseless. This was a sensitive point, often avoided in medical discussions, but impossible to ignore given the meticulous repetition of the descriptions. German professionals who collaborated informally with the researcher reported cases in which the patient described, after a cardiac arrest, details so specific that they seemed incompatible with the physiological state recorded in the medical chart. One mentioned the technical exchange of equipment, a defibrillator that did not fire as it should have, a fact confirmed by the team. Another patient, involved in a serious road accident, recounted hearing the surgeon ask for a special forceps during the attempt to control a hemorrhage. He even described the color of the forceps, a surprised surgical nurse would later report. Kübler-Ross recorded this type of coincidence with caution, but also with rigor, understanding that there was a phenomenon there that transcended the purely subjective realm. For many patients, these perceptions were accompanied by a profound change in the notion of time. The researcher heard the phrase countless times. It felt like everything was happening at once. This sensation of simultaneity, reported in both German wards and North American hospitals, arose even in situations of extreme emergency. Some described the scene as vast, expanded, as if consciousness detached itself from the linear flow of seconds marked by the operating room clock. A German cardiologist, after decades in his career, confided to researchers that, although he had never advocated for metaphysical explanations, he recognized that certain post-arrest accounts left him without an answer. He reported that a patient accurately described the conversation he had with a colleague in the hallway, a short, technical dialogue, while she was in ventricular fibrillation. None of this was in the medical record, and no one had commented on the episode with her afterward. Kübler-Ross treated such testimonies not as proof, but as indications. For her, they were signs that the human experience at the limit of death perhaps escaped medicine's traditional categories. The psychiatrist insisted that, even if everything could one day be explained by as-yet unknown neurophysiological mechanisms, ignoring the reports would be methodologically irresponsible. She argued that the quality of these testimonies, the clarity, the spontaneity, the absence of emotional elaboration, demanded serious study. Another little publicized aspect emerged in the emotional reports. Many patients described not only peace, but a feeling of absolute acceptance, as if the body's tension vanished. A pulmonary embolism survivor, treated at a clinic in northern Germany, said, "I knew I could stay or go, and neither thing scared me." This absence of panic, even in the face of a fatal event, intrigued the researcher. For her, there was a phenomenon there that went beyond explanations like the release of endorphins or common compensatory mechanisms in trauma. Kübler-Ross observed that upon returning, many patients brought with them a clarity that was not merely explained as the relief of survival. Some claimed to feel a kind of internal reorganization, as if something had changed, not in a supernatural sense, but a psychological one. And this point, rarely discussed, became one of the most significant parts of her work. Understanding the impact that the near-death experience left on daily life, long after the body had been stabilized. With the progression of interviews and clinical follow-up, Kübler-Ross realized that the most surprising phenomenon of near-death experiences was not only in the critical moment, but in the return. In that instant, when the body recovers and the patient tries to reorganize what they lived through. It was at this point, often neglected by medical literature, that a robust, consistent emotional pattern emerged, one that she considered essential for understanding what these experiences revealed. German health professionals reported that when the patient fully regained consciousness, a subtle but evident change in behavior occurred. Some who were previously extremely anxious returned with an almost disconcerting serenity. Others, known for explosive temperaments, came back with a calm that surprised their families. Kübler-Ross documented these contrasts carefully, avoiding quick explanations, but observing that many survivors claimed to have lost their fear of death. One of them, treated at a cardiovascular clinic in Hamburg, stated, "It's not that I want to die, it's just that now there is no terror left, only understanding." This type of statement arose in people of different ages and clinical conditions, which, for the researcher, indicated a deep and lasting psychological impact. She observed that it was not post-trauma euphoria or gratitude for survival. It was something more stable. Patients reported that, during the experience, they felt a kind of emotional clarity, and that this clarity remained for weeks, months, sometimes years. A German taxi driver said that, after his episode, he stopped having panic attacks that had accompanied him since youth. As if they had been switched off, he said. Another intriguing point recorded by Kübler-Ross was the changes in the perception of priorities. Many survivors reported that, after the experience, their routine changed effortlessly. They became less reactive, more tolerant, and more attentive to relationships. A Swiss engineer described it this way: "I came back different, as if someone had removed an internal noise that I didn't even know I was carrying." This type of transformation, repeated in testimonies from different continents, contributed to the researchers' conviction that the NDE was not just a liminal phenomenon, but also a profound psychological event. Despite this, Kübler-Ross faced resistance within the scientific community. Many colleagues claimed that behavioral changes could be attributed to the stress of the traumatic event. But she counter-argued that, if it were only that, she would see chaotic, varied, unpredictable patterns. However, what she found was the opposite: stability, repetition, consistency. very different people reported similar transformations, expressed with almost identical vocabularies. For her, this indicated that the NDE was not a post-trauma delirium, but a structured psychological event. There was also a sensitive element, the feeling of continuity of consciousness. Many survivors described not feeling an interruption between losing their senses and being in another state of perception. There was no report of emptiness, nor of a blackout. A German patient, after surviving a stroke, said, "I didn't pass out, I transitioned." Kübler-Ross noted this phrase many times over the years, from different mouths, in different languages, but always with the same meaning. For her, this was the point that was almost never discussed publicly. The near-death experience, instead of a rupture, seemed, in the patient's perception, an unexpected continuity. It was not about affirming metaphysical conclusions, but about recognizing that consciousness, at this limit, behaved in a way that medicine still did not fully explain. Concluding her decades of research, Elisabeth Kübler-Ross described near-death experiences as a clinical territory still poorly mapped. Not for lack of accounts, but because few professionals dedicated themselves to listening to them rigorously. Her position as one of the main scientific references on the topic arose precisely from this stance: record before interpreting, describe before concluding. And over the years, what she gathered revealed aspects of NDEs that rarely reach the public. The first of these was consistency. In different countries, from Germany to the United States, from Switzerland to Japan, the narratives presented the same central elements: clear perception of the environment during the supposed absence of consciousness, a sensation of body displacement, total absence of pain, and a calmness that contradicted the extreme conditions of the clinical moment. Kübler-Ross understood that none of these points, in isolation, was sufficient to establish definitive conclusions. But when repeated thousands of times, with almost surgical precision, they deserved at least serious investigation. Another aspect hidden from public discussion was the cognitive clarity reported by survivors. Many patients described that, during the NDE, they thought more clearly than in a normal state of wakefulness. A German engineer said that ideas came ready-made, like whole blocks. A Swiss teacher stated that consciousness seemed larger. This type of account, frequently noted by the researcher, contradicted traditional neuroscience models, which predict a reduction in cognitive function during moments of physiological failure. The psychiatrist also observed that, upon returning, many patients demonstrated profound psychological reorganization. The fear of death decreased consistently, some phobias disappeared, and behavioral changes persisted for long periods. Kübler-Ross was careful to state that these effects were not universal, but they appeared frequently enough to draw attention. She saw in this a possible field of study to understand how liminal experiences could act as catalysts for new internal dynamics. Contrary to what is imagined, the researcher never claimed that NDEs proved anything about the afterlife. Her approach remained rigorously clinical until the end of her life in 2007. What she argued for was simple, and at the same time profoundly challenging for medicine. If the subjective experience repeats itself with consistency, it deserves to be treated as data. If patients describe accurate perceptions during states considered unconscious, it is necessary to investigate. And if, after crossing the thin line between life and death, they return transformed in a predictable way, then there is a real human phenomenon there, regardless of its ultimate cause. Kübler-Ross frequently said that the NDE is less about dying and more about understanding how we live. In her final interviews, she emphasized that ignoring these accounts meant losing the opportunity to comprehend something essential about human consciousness. She recognized that answers were still missing, that the scientific field was advancing slowly, and that many of the questions would remain open for a long time. But she insisted that the first step was always the same: listen, record, and take seriously what patients experienced. Today, Revisiting her legacy, it is clear that what they never told about near-death experiences is not the extraordinary, but the obvious. The accounts exist. They are numerous, coherent, and come from ordinary people in well-documented clinical situations. What was missing for decades was precisely the attentive and methodological gaze that Kübler-Ross offered. And it is this gaze, sober, critical, profoundly human, that continues to guide the modern understanding of one of the most intriguing phenomena of human experience.